Good afternoon. Good afternoon, everybody. Thank you so much for joining us today for our June Prevention Exchange. This is a forum where we get the opportunity to share successes of the work that is happening across Ohio's community to elevate prevention science. And we also provide time to dialogue with each other so that we can learn and grow with it from each other. My name is Jen Morrell, and I have the honor of serving as the Managing Director for the Ohio Center of Excellence for Behavioral Health Prevention and Promotion. Today, our theme is celebrating coalitions, utilizing science and leveraging resources for maximum impact. So before I introduce today's speakers and our Prevention Exchange moderator, I just wanted to share just a little bit about the center. If you've joined us before, you know that I like to kick things off by sharing our vision, which is to operate from a purposeful perspective of excellence, keeping in mind the impacts of structural and social determinants of health as we strive to impact local prevention practice. To do that, our main goals are really to support our prevention professionals and interested parties to institutionalize those core components of behavioral health prevention science, and then of course mental health promotion across the lifespan as well. We also try to diffuse and support the implementation of those research-informed frameworks and try to make sure that we're supporting you and blending them with the prevention science. And then our goal is to become a central access point for everybody working in the field to help develop this skills, knowledge, and attitudes that relate to prevention science. So if you have not begun to receive our monthly newsletter, we encourage you to sign up. The only way to receive the newsletter is to sign up for it. So if you haven't received it, we just dropped our June edition about an hour and a half ago. So if you're interested in receiving that, send me a direct message and I'm happy to forward. But if you want to continue to receive them, just scan that QR code and enter your name and email address. Today, we are delighted to bring you the prevention team from Exclusive Services down in Cincinnati. We have Dr. Njoku, who serves as the Prevention Project Director, joining us, and he is accompanied by his colleagues, Dr. Annabelle, and then Mr. David Walker. And they're going to speak to how they were able to leverage resources from Drug-Free Communities funding to place their coalition in a really great spot in the community to leverage and start creating environmental change strategies. So today's learning objectives, real quick, before I introduce Tessa, is to identify strategies to build community ownership for community change efforts, and then discuss national and state resources that are available to build and sustain Ohio's coalitions. So we have our talented session moderator today, Ms. Tessa Miracle from the Pacific Institute for Research and Evaluation. Tessa serves as part of the center's facilitation team and is a research scientist with PIRE. So I will turn it over to you, Tessa, to kick off our party here.
Wonderful. Thank you so much, Jen, and thank you everyone for joining us today. We have an action-packed hour, so I know we like to get these going right away. As we look at our time together, we're going to have some brief introductions from our panelists, who we are so grateful for spending their time and energy with us today and sharing the knowledge that they have gained in their work, and share the work that they're completing within the community to make their community a better place. We're going to facilitate some discussion around that, and then we're going to go into some breakout rooms and allow you to work with our panelists a little more one-on-one. So as a note, we recognize that the session is being recorded right now. So please, join us in any way you're comfortable. Don't feel like you have to be camera on. Our breakout rooms will not be recorded though. So that's where you can bring some of that informal conversation that maybe I don't have the idea fully formed yet, and I'm still working through. So I would like to invite our panelists just to share some brief introductions. Excuse me. share some brief introductions and a macro level of your work. So Dr. Njoku, would you like to start?
Thank you so much. And if you permit me, my name is Dr. Benedict Njoku, and I'm the Prevention Project Director at Exclusive Services. And of course, I have with me here my coordinator, like they say, Dr. Annabelle, and my community coordinator, Mr. David. Just to save our time and just to also show us a broad overview of who we are and what we do by way of introduction, I'd like to hand off to Dr. Annabelle to kind of share her screen and slide, about who we are, as a coalition, what we do. Thank you.
All right. Sorry. My name is Dr. Annabelle Obinakakoro. I am the Prevention Program Coordinator at Exclusive Services, the Cincinnati for Hope Coalition. So we're going to start today by looking at an overview of the Cincinnati for Hope Coalition, what we do, and the impact of what we do. All right. And so Cincinnati for Hope Coalition, the target of Cincinnati for Hope Coalition is to meet African American youth at age 7 to 12 who attend inner city public schools. Our goal, however, is to increase the community's collaboration and reduce youth substance use by focusing on some substances that are broadly abused, like alcohol, marijuana, tobacco, or non-medical prescriptions. We engage with the 12th sector of the community, the police, the parents, the youth, the school, and other youth-led organizations and agencies to provide activities that engage these students, engage youths. And then we act as a voice to these students and the youths. We serve 9 specific urban neighborhoods in Hamilton County, which includes Avondale, Kerrville, Everson, Fairfield, Clifton Heights, Mount Auburn, Over the Rhine, Walnut Hills, West End, and Queensgate. So I would want us to look at this video. This video will explain broader what we do. So leave it show and tell. Listen. So these are some of the programs that we provide: the youth leadership and development, youth leadership, entrepreneurship development. This is the Catch My Breath program we provide in schools. And this is the wellness curriculum that we also provide in schools. We also participate, get paid to gain programs so that students can learn productive ways to earn money. us anytime. Send us an email if what we do resonates with you.
Okay, thank you so much, Dr. Annabelle. I know we don't have, there's a lot of slides, but we don't have time. So we just stop the slideshow here. And so again, I just wanted us to give us an overview of who we are and what we do. It's a long slide, so it's an entire presentation on its own. So thank you so much. I hope that was able to answer the question of who we are and what we do.
Wonderful, and thank you so much for providing such beautiful representation of your work. I really appreciated the music. I do want to call out over the chat. I did receive a couple of direct messages saying folks couldn't hear Dr. Annabelle over the music. So Dr. Annabelle, do you mind providing just a couple of brief, what we would call bullet points to summarize what you were sharing, just in case everyone's audio works a little different?
All right. Cincinnati for Hope Coalition, like we've said earlier, is a youth-focused coalition. What we do is to provide prevention curriculum, provide prevention programs to at-risk youths in schools and in the community. And so we have 4 basic curriculum at which we provide in school to meet every child's needs. They're evidence-based, and the aim is to build the capacity of these youths and then provide healthy alternative to some risky behavior. Some of it include our Catch My Breath vaping curriculum, have youth leadership development and entrepreneurship program, which provides youths with entrepreneurship opportunities and teach them leadership skills that will help them both become functional adults and then become useful to the society and to themselves, and also their families. We also have life skills, like a general holistic curriculum, which prepares them to become adults that are purposeful, purpose-driven adults. And then we have our wellness curriculum. The wellness curriculum takes care of different aspects of wellness, both the physical wellness, financial wellness, social wellness, all aspects of wellness. And so the aim of our prevention programming is to ensure that these youths are able to become a better version of themselves. Like I said, we show them a way, we show them, healthier choices to risky behavior. Risky behaviors, we mean like different addictive behavior, drinking, binge drinking, substance use, marijuana, alcoholism, and all that. So that's what we do. We also provide trainings, both online and in the community. We just concluded our Fit and Inform program at the Dillard Building last Saturday, where everybody came out, we taught people the importance of being fit and then ways of improving their mental health through making healthy, informed choices. Like we had different presenters and all that. And so we teach the young ones the way to go, like we point them to the right direction as to be able to be functional as youths and also grow to become healthy. So we are emphasizing on health is wealth. You have to be healthy to become wealthy. That is a general overview of what we do. And we have taken this mission beyond the shores of the United States. We are also in Africa, Nigeria, where we do exactly the same thing. We are replicating our model of integrated healthcare to Nigeria. And so we are trying to meet people also in Africa. Thank you.
Thank you so much. I really appreciate you clarifying. Oh, sorry, I didn't mean to cut you off, Dr. Njoku. Go ahead.
Oh, no, thank you. I just wanted to add a few words to what she said. We are like every other coalition, DFC funded, and we have the 12 sectors of the coalition, and areas are youths 7 to 12th grade. And we, the work that we do is guided by the seven aspects of community strategy, which is provide information, build skills, provide support, enhance and access, reduce barriers to protective or risky factors, change consequences, change physical design, and also policy making and policy decisions. So everything we do, this is the general umbrella that kind of guides the work that we do. And we are very active in about 3 school districts right currently, apart from the community. And we are moving, hopefully this new academic year, we're moving into our 4th school district. Our school districts are Cincinnati Public Schools, Sycamore School District, Ideal School District, and we're moving into North College Hill School District, hopefully by the time the school opens. So we have quarterly coalition meetings, and we have monthly group meetings, depending on what we're looking at or what we're trying to address at a particular point in time. So I just wanted to add that to what Dr. Annabelle said.
Wonderful. Thank you so much for sharing that. I appreciate it. I know each of you brings a unique perspective. And so, when we think of teamwork, I think you've really embodied using the science to identify strategies and identifying team members who can take on different components of the strategy to holistically address the needs of the community. So you shared how you're using the CSAP strategies. I believe we're going to link in the chat. Our friends at Ohio Mental Health and Addiction Services have provided a guidance document, and within that we can find the CSAP, Center for Substance Abuse Prevention, which their name will change soon to have less stigmatizing language in it, those research and evidence-based strategies within the guidance document. So that will be listed in the resources for you as well, just to hold that up for you. So Dr. Njoku, you talked a lot about how you're using these evidence-based strategies of information dissemination. We're building capacity within our community. We're conducting a community-based process. And within your work, you're identifying needs that are sort of within those communities within our community. So some of them are, within a school-based setting. Some of them are in different settings. So you did a really good job of talking about how you're identifying those broader community needs. I'd like to see if you could share a little bit more on how you identify your team members to support the need. And then we'd love to hear more from Mr. Walker and Dr. Annabelle about maximizing opportunities for engagement in planning a school-based experience based on need from Dr. Annabelle. So I'm going to hand it back over to you, Dr. Njoku, as you've described, this broad context of identifying need within our community. Well, then we kind of have to build our team a little bit. So, we have all these strategies we've identified, and you've identified a couple of great team members. We'd love to hear about that as we continue to talk about how we're using science to impact our communities positively.
Thank you so much, and thank you so much for that. We all know, and if we're very familiar with the SPIF, the Strategy Prevention Framework, we'll understand that a needs assessment or assessment is the first step, and is the most critical step to anything that you do in terms of prevention. And so, and that's actually where the prevention work begins. So as a coalition, and I think one of the wonderful things about being a coalition is that, you have people bring in their different ideas, perspective. Coalition is basically people coming with their different identities, different organizations to come together. So in that collaboration, nobody loses their identity, but instead we're bringing in a unique characters, trait, experience, and all that into doing a share or common goal. So, and this is really what is very interesting to the work that we do, for that we have such unique partners, collaborators, who bring in all the things that they have to the table and to join the work that we do. I'm just saying that. So needs assessment is very critical, and we do a lot in just, we're always trying to, feel the pulse of the community and to understand what the community needs, which really guides the work that we do to try to help the community. We collaborate with Public Health Department. They are, they're one of our partners, and from there, they tell us the community needs from the assessment that they have, and we use that as one of our guiding template to kind of address the community or try to help the community. We have our yearly, sometimes yearly community needs assessment that we have. We're actually in the process of doing one now as we speak, because we are trying to also review our logic model for the next grant, DFC cycle. So we're in the process of kind of collecting data from the community, and so because we have partners like the school district, so they allow us to kind of check what check what the school needs by virtue of just enabling us to do a pride survey on the schools, right? So we give them pride survey to just check the pulse of the students, see what they're talking about, what they need. We also have like our focus groups that we do in the community. We have our listening sections and interviews and questionnaires that we do that kind of allows the people to kind of tell us what they need so we can be able to help them. For example, yesterday, myself and Mr. Walker, we were invited to a community leaders forum, organized by Cincinnati Black United Front, which is run by our coalition chair. The mayor was there, the vice mayor was there, city council members were there, city manager was there, and there we were talking about community needs from the lens of the students, right? They told us what they need, and now I have the paper, the blueprints, and we're about to swing into work to kind of begin to address some of these things that they have. So I think in a nutshell, my point is that just having stakeholders on the table with you, who are gatekeepers, allows you to be able to have access to the people that you need to gain access to. And by extension, you can be able to ask them what they need. Because if we enter into helping the community from our own lens, then we are already doomed to fail from the beginning. But then if you allow the people to tell you what they need or what they think that their need is, it allows them to buy into the process of you trying to help them from the prevention standpoint. So I'm, in the process of studying the documents that I have from the community, from the students at Woodward Technical School. And by virtue of the meeting yesterday, we are also setting up shop at Woodward to be able to provide services to them and help them. So it's actually, good, wonderful. So community stakeholders are key. I don't know if I was able to answer your question. Having first of all the buy-in from community stakeholders, having them to be part of your process, have an agreement with them. When they come and join you, they open the doors to all the people that they serve, and that makes it easier for you to just have access to them to be able to help them. Don't go into anything without partnership or cooperation. No man is an island unto himself. You need people around you, around your table, to be able to work with you. That is how you work smartly and not hard. Thank you.
Absolutely. Thank you. In that work, you have completed so much community outreach. You have really passionate staff member, Mr. Walker, who's talked about how this was such a natural combination of a passion he had for his community. I would love to hear from you a little bit more how, we selected our strategies for our community using, using an evidence-based process. And now we have the opportunity to combine that with passion. So Mr. Walker.
Right. Greetings. I want to first thank you all for having us back with you. So it's a pleasure, and I'm very happy to be on this panel. So in a way of maximizing natural opportunities for engagement, to speak to that, I will say the way I became a member of Exclusive Services and Cincinnati for Hope Coalition, I was actually the subject of that strategy while trying to exercise that strategy at the same time. And what I mean by that is, I had already been in the community for a long time, for like quite a few years, trying to organize members of my community to make improvements, make adjustments, and to make the community and city overall a better place to live in. I went through a program. Got a mentor, and the mentor happens to be the CFO of the company. And he told me, well, shoot, if you, it's about time we start getting you paid to do what you do, and he said, you just have to adjust it here and adjust it there in order for it to work on this team. And I did. And that's how And that's how I came to be. So what my mentor / the CFO of Exclusive Services did was he saw my strength. He saw what was natural to me, and he created the space for me to exercise that. And so it is with coalition building in general, or trying to get people to participate in programs and things like that, seeing what their strengths are, what comes natural to them, and then allow the space for them to, show whatever their talent is, whether it be music, whether it be presentations, whether it be, for example, at the Fit and Informed Wellness event, that was an opportunity for trainers and holistic people to come and share their business, their practice, so on and so forth. Again, just emphasizing people's natural talents to push the cause of prevention.
Wonderful. Thank you so much for sharing. And I love how, you described it. Like originally I was a recipient of the prevention services, and then I was able to join. And I think that is, that is a story we hear as folks enter the prevention workforce. And so I know in a couple of months, we'll be talking a little bit more about workforce, but I just wanted to uphold that. Dr. Annabelle, I know that your work really focuses on a school-based setting. You use your own training and the science within psychology to plan out programs and plan out your strategies. So we'd love to hear a little bit from you.
All right. Like I said, okay, I haven't said that yet. So a way of introducing myself, my name is, like I said, Dr. Annabelle. I am a school psychologist. I have a doctorate degree in school psychology. And so I apply the principles of school engagement in planning the curriculums that we put in front of the kids in school. And so talking about planning this curriculum using evidence-based program, we have to, as Dr. Ben has said, always put into consideration the aspects of the community, the 7 aspects of the community change in planning this curriculum. And that includes providing information. That means your curriculum, your school program should be able to provide information. You should be able to build skills. Your school program should be able to provide support. And then you should be able to enhance access. You should be able to change a particular or an identified consequence. You have to identify the consequence that the school program is going to change. And then you should also change some physical designs and then modify some policies or get towards modifying some policies. And so in planning the school curriculum, you should also have put in mind some prevention strategic framework. And so I'll just mention some. And so if you are looking at making or providing a curriculum that meets specific needs of schools, you should be able to have assessment. You should be able to do an assessment. There should be capacity, and then you have to sit in a team and do proper planning. I'll talk about the planning process. And then from the planning process, you look at ways which will be efficient in implementation of this curriculum. And then there has to be a properly placed, you have to put in place some evaluation. There has to be evaluation. So you have to put that into consideration. Some metrics evaluation and how often you have to evaluate that program to ensure that you're meeting the goals and the objective of the program. And so, like I said, we'll look at the planning process and planning the curriculum using evidence-based program. There are 3 components I want us to look at. I for sure emphasize on the structure. What is the structure of this curriculum you want planning, and who should it meet? And so in looking at the structure, you look at the program type. What kind of program are you planning to implement? Who is it geared towards meeting? Is it going to meet the school? Is it going to meet the families of students? What aspect of family life or student life is it going to meet? Is it going to be an alcohol-based curriculum? Is it going to be a vaping curriculum? Is it going to be a gambling? You determine what kind of curriculum you're planning. And then you look at the audience. Like I said, it has to be structured. The curriculum you're going to implement in elementary school is different from the curriculum to be implemented in the middle school, is different from the curriculum to be implemented in the high school. So who are your audience? That should be put into practice. And then the setting, where are we going to implement this curriculum? You look at the school environment, the environment where the school is, not just the school environment, but where the school is set, like the neighborhood, what are the peculiar things about that neighborhood? You put all of that into practice, put all of that into consideration. And then the next structure you look at is the content. What are we planning to implement? You look at the information which is supposed to be contained in that particular curriculum. Like I said, these are the things I put into practice, or the team puts into practice when we're planning our curriculum. And so the information also includes what the message is going to be. What are we going to talk about? How are we going to talk about what we want to say? So what, how, and then you go into the why of the information. What are we going to talk about? How are we going to talk about this? Why are we talking about this particular message? What is the purpose of that message? And then every message should be able to develop a particular skill. What are the skills you're developing? Are they cognitive skills? Are they affective skills? Are they psychomotive skills? So what is that particular message? So what skills are that particular message is the message going to develop? Also put that into consideration. And then you look at strategies. What are the strategies you're going to use in delivering that particular message? Are you going to do, is it going to be audio? Is it going to be video? You put all of this into consideration as you're planning the curriculum. And then the services, what are the services that are required? Do you need more hands? Do you need a school? What are the extra things you should put into consideration in planning? Who should come to the table ensuring that this curriculum is effective? You also plan that as well. Then the last component we're going to be looking at is the delivery. How are you going to put this? What is the action? How are we going to implement this? And then you select the avenue which you're going to deliver the curriculum. Our curriculums are structured in such a way that you can deliver it through the media, can be in person. And so we also look at, we put technology also into view when we're planning. And so we do it in a way that anybody can deliver it, through whatever means. And so your curriculum should be able to meet the different learning styles of the people you are planning it for. And so the keys in elementary are audiovisual learners. You have to put that into consideration. The keys in middle school and high school are not really audiovisual learners. So in planning, you must put in place that which suits every learner, the learning style of every learner. And so you must also look at how you intend to implement this. There are some that you need to be there, implement once a week, twice a week. You look at that frequency. And so the next you're going to look at is the evidence-based program that will be suitable for this curriculum. What evidence-based program do you think? Do you need the scaffolding program? Must it be cooperative? Is it going to be collaborative? Or is it going to be competitive? All these are the things you put into place to ensure that your program, the program you're planning meets the specific needs of the school. I hope I've answered that question.
You absolutely have, Dr. Annabelle, and thank you so much for sharing a little bit more about your roles. Each of you, I really appreciate you going more in depth. We have time for some breakout rooms today, and we would like to invite you to select your own breakout room. So breakout room number 1 is Dr. Njoku, and talking about identifying those broad community needs and using science to meet those needs. I know the name is a little cut off there. So Mr. Walker is going to host a breakout room about maximizing natural opportunities for engagement. And then Dr. Annabelle is going to talk about what it's like to plan those school-based experiences. So I am going to open these rooms. We will come back together in 15 minutes. I will send you a couple warnings. We'll bring us back together. We'll share our, sort of aha moment, our the highlight of our conversation. So be in each breakout room, be looking for that one person who is going to report back, and we'll just see you in a few minutes. So I'm opening the rooms now. Thank you so much for joining us and for joining those rooms. Really appreciate you sharing, sharing your time with one another and having that informal work time. So I'd love to hear from our groups. What was something you learned, or what was the highlight for you?
Okay, for me, I was with Mr. Walker because I thought he looked kind of familiar. So in the group I was in, so we talked about basically how he engaged the children, the students or the kids. And then I know one of the persons in our group, she was asking more so about the parents and about them being engaged. And basically it's for the kids, but he was talking about a program, how he does go into a community, which I'm familiar with in Ohio, in Cincinnati, and how he engaged a lot of those kids with helping them with learning things, and then taking it back to the parents and teaching them some things.
Awesome. Thank you for sharing. Who else has something impactful that they'd like to share?
So I'll mention Dr. Ben and I were talking quite a bit about coalition structure and utilizing the science, and just, it was nice for us to really chat about how important, integrating that science is into all of our strategies. But also a nice reminder that, so often we hear environmental strategies don't necessarily cost anything, but they do. And it's important that when we hear things like that, we remind people, we remind our communities that there aren't necessarily direct costs or like tangible supply costs, but human capital and human effort is not free. And there's no way that these policies and these strategies would move without all the effort of our coalition members. So, we morphed into a little bit of appreciating coalition members and just kind of nurturing those relationships so we can continue to elevate the science.
Oh, wonderful. Thank you, Jen. Oh, I do see a hand up.
The hand will be mine. Thank you, Jen. And again, talk about collaboration is always, especially from the big area of needs. Sometimes we just work in different silos, each person and do their own things. So it's nice, just like we got connected with Ohio Center of Excellence and we're working together. It's just nice for organizations, even especially those that have similar interests, to kind of come together. It's nice when we all share our resources. It enables us to reach wider and to work better in the things that we're trying to do, or unlike just doing it independently, in our different silos. So just coming together to just do work together as organizations is really nice, and it's really, really effective. And for individuals, I know that these days time is money, but if you have any coalition or organization that is doing, environmental level, individual level things, making change in your community, please join them, volunteer, and do something. Be an agent of change in your community.
Wonderful. Thank you so much. I appreciate everyone joining us today and spending your afternoon with us. This time does always fly by. So I want to invite Jen to share a little bit more, some closing remarks and our evaluation piece. We do only have a couple of moments left, but don't feel like you have to rush off. If you'd like to stay and discuss further, you are welcome. We will conclude the recording at 1.
Absolutely. Thank you so much, Tessa. And thanks to each of you for spending the last hour with us. We continue to learn with and from you, just as you are learning with and from each other and our panelists. So as we are still working to build the center's footprint, I just wanted to invite you all to continue to follow us and connect with us. Social media is really the best way that we are able to communicate updates with the prevention community in real time. We strive hard to update our center website and make sure that is getting events out as well. So invite you to follow us on either of those channels. And then lastly, we want to hear what you think about today's session, the general format for Prevention Exchange. We've already made some tweaks along the way. We have some exciting tweaks that we're making in the coming months because of your feedback. So just a moment of gratitude to each of you for joining us, for respecting and appreciating the speakers and our team from Exclusive Services today by filling out that 4-question survey. It might be 5, don't hold me to that exactly. So we have our July theme for the center communications, whether it's our podcast, our blog, our Prevention Exchange, is going to be the power of networks. And so we're working to line up a couple of amazing guests. And so we encourage you to save the date for Thursday, July 27th. We'll see you back here at the same time, same place. So by registering for today's session, future meetings will automatically pop up on your calendar so you don't forget about us. So hopefully you can join. And if you have any time off that you're planning this summer, time to reflect as the state fiscal year closes, school's out, I hope you get a chance to slow down and think about all of the successes that you've experienced over the last year. We're grateful for you and all the work you do to elevate prevention across Ohio. So without further ado, I guess we'll close up for today and wish you all the best until we see you next month. Bye, everyone.